Okay, so I want to show you some new running shoes that I got. I've just put in a clip of the shoe store because they measure your feet and the way that you apply pressure or something. It was like quite technical because it's a running store. But anyway, these are the shoes I got. Here we go. They had to be men's shoes because my feet were too big for the women's sizes, which is great. So these are the brand Solinco, I think, which I know is like a good running brand. That's all I know. And they're really good. Like, I got them with the specifications that my podiatrist asked for, based on like the way that my feet, like the way that my arches are and stuff like that. And I've tried them for a few walks so far, and they're really good, really comfy. And I went on a few like long walks as well, and my knee was pretty fine. So yeah, the reason I went to a podiatrist for this was to try and find another solution for my like chronic knee problem. And so far this is really encouraging. So I'm very happy about that. Yeah. So I finished my physio for the week. I'm exhausted because the sessions last like 2.5 to 3 hours. And just feeling a bit low because the pain sort of got worse each session. Like, not huge amounts, but it has got worse, specifically today. And I'm just a bit worried about, like, you know, that's not a good sign. So, I mean, now I have 2 days to just rest, which will be nice and will certainly help the pain, but it's just a bit, I'm just scared because we've like kind of upped the intensity and the pain is like increasing and we don't really want that. But I'm also getting different sensations in my arm to how it's been for the longest time, so I don't know if that's like a good sign. It's like different types of pain. It's like more electric than burning, which is less it's more enjoyable. I mean, no, like, it's not enjoyable because it's pain, but like I meant it's less unbearable when it's like electric rather than burning. The burning is really like the worst. So yeah, I don't know, but we'll update you after the weekend. Okay, so it's been a long time since I last did an update, but honestly, the last few days have been really difficult. I had physio yesterday, which was a Monday, and Friday before that I had the weekend off. And I've basically been in almost constant pain since Friday. Like, really strong sort of burning, electric sensations in my fingers. It's really bad at night, like it kind of keeps me awake. And I was talking to my physio about it yesterday, saying I'm really discouraged and concerned about this because the pain has never been this bad. And he had several theories. He was like, well, you know, it's normal. We started strengthening, so maybe we've got a bit too hard. Like, the nerve is probably being messed around with a bit too much. So he was like, we need to try and keep strengthening, but maybe with like lessen the load or the reps. So that was like one of his theories. And then the other was that, well, he said the nerve is like growing back and healing. And that can, in some cases, that can be very painful. Which, you know, it makes sense. But the thing is, with what happened last year after my surgery, where I had kind of burning, not as strong as this, and I was thinking, oh, that's good, you know, it's normal, the nerve is regenerating. And then months later, when we did scans, we saw that the nerve was fully trapped and not healing at all. So that's why I'm having a scan this week. Honestly, so much rests on the result of that scan. Like, if it's positive result, it'll be so good because a lot of the stress will go away and I can focus on my rehab. But if the results aren't good, then I don't even want to envisage that because I think it's going to be such a hard blow to take. But we will see. It's on Wednesday, so in 2 days' time. So fingers crossed for that. Just had my scan, and honestly I feel really low right now because the scan didn't really show any improvement, and I'm just so sick of being in pain and dedicating so much time to my recovery and feeling like it just amounts to nothing, and that I'm basically never going to be out of this pain, that even writing and doing stuff that people don't even think twice about is going to become, well, it's going to stay painful. even though it already has been for like 4+ years. It's just so scary. Yeah. Okay, I have been slacking off a bit with this video updates because I have so much to update you on, like, in this one go, I guess. So first of all, like, I was feeling really low because of physio. I was like, I'm in more pain every session, but the one positive thing is that the session I had yesterday, what day was yesterday? Tuesday? Wednesday. Okay, time's flying. I had a session on Monday, went really badly, and then yesterday was better. Like, the pain was a bit less than on Monday, so any improvement in pain I will take. And I did all the exercises, all the treatment, so I felt very happy about that. Yesterday, I also had a scan on my elbow, the long-awaited scan, to see what was going on, you know, inside here since the surgery. So I was really nervous before it. And it's an ultrasound scan because that's the best way that you can see nerve and tissues around it. Like in this case, not an MRI. I have my, like, report from it, and don't know if you can see. I might not show you the images because there's like personal information on there, and anyway, it looks like lasagna. Hang on. Okay, so that is the nerve. We can see it's still swollen, and that is the scar. Like bits of scar tissue. Now the doctor saw that the nerve is still just as swollen as it was before the operation, but he said that we can't really conclude anything from it because in a lot of cases, the nerve doesn't return to its normal shape and size, but the symptoms go away. There's also vice versa, where the nerve improves, but the symptoms stay. And so he said not to panic too much about that. He did say there's a likelihood that it will never return to like a normal size, but my surgeon says that it will just take a long time. So we've got a bit of like contradictory information here, which is a little bit annoying, but it's a very peculiar like pathology, so it kind of makes sense that we don't have concrete answers. The main thing that came out of this scan, though, is that the nerve is not trapped by scar tissue or anything anymore, which is really good. Whereas before the surgery, we could clearly see on scans that there was compression of the nerve, and when there's compression, you can't get any improvement. So now there's no more compression, the nerve is still just damaged, but now there's nothing there that's like irritating it. So that's a really good news. That means that the surgery went well, and that so far the scarring is going much better than last year. The doctor saw that there was a lot of scar tissue inside that was kind of like touching or close to the nerve, but not like, you know, swallowing it like before. So that's very positive. He also said that there was no like edema inside, which is good. That's like very inflammatory reaction to surgery. So that's all gone down. So I'd say overall, like, pretty good. That I read the report and I've been able to calm down and rationalize it. I'm feeling a lot better about it than I did yesterday, because my initial reaction yesterday was really negative. I was like, it's still swollen, I'm never going to get out of this pain, which was a bit of a catastrophization. Now today, this morning, I had my steroid injection in my hip because, as I've said in previous videos, I have a labrum tear in my hip. Finally had an injection to sort it out. So this is steroids, it's like anti-inflammatories, done with an x-ray so that the doctor can see like where the needle is going. So I was lying on like an x-ray machine, and this doctor was like wearing a lead apron and like doing the injection. And I made the big mistake of looking at the screen, and on the screen there's the x-ray images, and you could see this needle, this huge needle, like in my hip joint. I almost threw up. It was horrible. I'm actually going to show you the picture from the x-ray. So if you're like sensitive with needles or queasy, like just skip this bit. but I thought it was pretty like interesting. I will show you. There she is. That's the needle. That's huge. Going into the hip joint, ball and socket, as you can see there. So that was, yeah, in my knee, my hip. It was not enjoyable, but it was done pretty quick. Now I have 2 days where I literally have to rest so much. Like I can't really move. Like even going up and down stairs is like kind of risky. And after those 2 days, I can, to use the doctor's words, I can return to normal life without sport. I'm kind of like, well, that is my life at the moment. So yeah, whole lot of updates today. Okay, so quick little update today. It's how many days since the injection? 2 days. It's been 2 full days pretty much. So I went for a little walk today, very exciting, after 2 full days of pretty much full rest. I went for like a 10-15 minute walk, and my hip was kind of painful, but it's normal with these steroid injections. It often hurts more in the few days after, and then it takes like a week to have the full healing effect, so still waiting for that. Obviously not able to do physio at the moment because of that, but I've noticed my arm's feeling a bit better. Like I'm not really paying attention to it as much day to day, which means that the pain isn't like as bad. And also, like I was just noticing just now, like as I was putting clothes away, I noticed I'm just using my arm a lot more naturally, like pretty much fully extending it, carrying some things. Like, yeah, it's fun because it used to be that I'd have to think, okay, I can't do this movement, I need to use my left hand, whereas now I'm more almost like automatically using the right arm. So that's like a good sign that I'm like gaining the use back, which is exciting. So yeah, that's it for today. So it's been 4-5 days since my hip injection, and I'm in more pain now than I was before, and I'm a bit panicking about it because I don't think this is normal. Like they said, the pain increase should be for the first 2-3 days, and it's been 5. And I'm not feeling any improvement, and I'm just kind of scared that the injection hasn't done anything, and yeah, I don't know what to do. I'm trying not to panic, and you know, the guidelines that they give you, it's like a general rule. I'm sure some people have no increase in pain, some people probably have it for longer, but yeah, I think once it'll have been a week after the procedure, I think that will be the time to panic. But yeah, for now, just gonna try and calm down and not analyze the pain too much, but it's rough today.